Assalamu alaikum. Hi. I am Dr. Asad Saleem. Before starting video, subscribe my channel and enjoy medical lecture on Wilson's disease is a rare genetic disorder. It disrupts your body's ability to manage copper. Copper is essential for our health, but too much can be toxic. In Wilson's disease, copper builds up in the liver, brain, and other organs. Imagine a garden hose with a kink in it. The water, like copper, can't flow properly and starts to back up. This buildup of copper can cause serious health problems if left untreated. Wilson's disease is often diagnosed in people between the ages of 5 and 35. However, it can affect individuals of any age. Early diagnosis is crucial because timely treatment can significantly improve symptoms and prevent long-term complications. Wilson's disease can manifest in a variety of ways, making diagnosis tricky. Some individuals experience liver-related issues. These can include fatigue, yellowing of the skin or eyes known as jaundice, and fluid buildup in the abdomen. Others may exhibit neurological symptoms. These can range from tremors and difficulty speaking to changes in behavior and personality. It's important to remember that these symptoms can also be indicative of other conditions. If you notice any of these symptoms, don't hesitate to consult a doctor. Early detection is key to managing Wilson's disease effectively. Diagnosing Wilson's disease involves a combination of tests. Doctors will begin by reviewing your medical history and conducting a physical exam. Blood tests are essential to measure copper levels and liver function. A specialized eye exam can detect copper rings in the cornea. These rings, known as Kaiser-Fleischer rings, are a telltale sign of the disease. In some cases, a liver biopsy may be necessary. This involves taking a small sample of liver tissue to examine for copper accumulation. Genetic testing can confirm the diagnosis and identify family members who may be at risk. The good news is that Wilson's disease is treatable. Treatment typically involves medication to remove excess copper from the body. These medications work by either binding to copper or preventing its absorption. Dietary modifications are essential in managing Wilson's disease. Limiting copper-rich foods is crucial. These include shellfish, liver, mushrooms, nuts, and chocolate. Your doctor or a registered dietitian can provide a personalized diet plan tailored to your needs. Living with Wilson's disease requires ongoing management and regular checkups. However, with proper treatment and lifestyle adjustments, individuals can live full and active lives. Remember, early diagnosis and consistent care are vital for successfully managing this condition.